Good morning, everyone.
Good morning.
Hope our mic is working today. There's a good mic check today. Outstanding. I'm here to announce two more positions as cabinet agencies here in North Carolina. I'm proud to announce that I am naming Dr. Mandy Cohen as Secretary of Health and Human Services, and I am appointing Mr. Larry Hall as head of Veterans and Military Affairs Department. We are excited about both of these. Dr. Cohen is a physician. She attended Cornell, graduated from Cornell University. At Cornell University, she went to Yale Medical School and graduated from the Harvard School of Public Health. She served as a physician for female veterans in the VA hospital and has, over her career, extensive background in healthcare public policy. Most recently, she was the Chief Operating Officer and Chief of Staff at the Centers for Medicare and Medicaid Services in Washington. And there, she led policies for Medicare and Medicaid, children's health insurance, and working to make sure that people got health care coverage. And clearly, we're going to be entering difficult times in the area of health care. We need a good manager, someone who understands healthcare policy and healthcare arena. And we are lucky to get Dr. Cohen to agree to come and head up our department in North Carolina. Larry Hall, many of you know, because he has been a leader in North Carolina for many years. He is a 16-year Marine and Marine reservist. He believes strongly in a strong military, our North Carolina military bases, as well as caring for our veterans. Larry is a fine attorney and a public servant who has served as the North Carolina House Minority Leader. He will provide vision and leadership. He understands the importance of our military bases to the economy in North Carolina. He will be visiting the communities around these military bases. He will be working closely with people in Washington concerning our military bases. And he will work to make sure that North Carolina veterans are treated like they should be because of their courageous service on behalf of our country. And Larry and Mandy were just talking a little bit back in the library about the importance of health care to veterans. So it would be appropriate that we have both of them here today. Larry is a graduate of Johnson C. Smith University, and also he has his law degree from UNC Chapel Hill and is a fine lawyer as well. He's been a lifelong resident and leader in Durham County. So I'm going to first have Dr. Cohen say a word or two to you, and then Larry Hall, and then we'll take it from Dr. Cohen.
Good morning, and thank you, Governor. I'm so honored to be joining the Governor's team and be entrusted with this incredible role. It is such an honor. The Department of Health and Human Services touches the lives of really everyone in North Carolina. Young, old, rural, urban, whether you need longer-term medical assistance or something short-term after, say, like a hurricane like Hurricane Matthew. And that's why I'm so excited to join the team here and work on enacting the Governor's vision of building a healthier North Carolina. As a physician, I know how critical it is for folks to have access to affordable, high-quality health care. And that's what I hope to work on, to bring to work on in North Carolina. And as well as dig in and lead the rest of the department's critical work to help our most vulnerable, whether it's disabled. There's so much important work to be done. Can't wait to get started. I'm ready to go. And I look forward to working with the other leaders in the state to build a healthier North Carolina. So thank you so much for this honor and opportunity. And I look forward to your questions.
Well, good morning, everyone. I'm certainly glad to serve in another capacity here in North Carolina. And one of my great loves is the veteran population and the military population in North Carolina. I have a quick story, and I'll make it quick, but just the fact a lot of people don't know, but I come from a multiple military family. My father was a career Army officer, grew up on Fort Bragg, stationed there. My brother was in the Air Force, familiar with Seymour Johnson, and of course, I'm a Marine and spent many years at Camp Lejeune. So kind of bring those together and my thoughts and appreciations for military and veterans across this state. Understanding that we have over 600,000 veterans in this state and military in this state. Understanding that approximately 15% of our economy is based on that, and military and veterans-related issues make up a lot of the economic development in this state. So we'll be working to ensure military, not just veterans, but their families receive the best care, best access, and also making sure that their position is recognized as an economic leader in the state. And we'll do all we can to ensure that position is preserved and advanced with the help of all other folks on the team. So I'm glad to be on the team, leading North Carolina forward under our new governor, and I look forward to working with all of you. Thank you so much.
Thank you, Larry. As I've said many times, that the overall mission of this administration is that we want to see a more educated, healthier North Carolina population with more money in everyday people's pockets. And we want to make sure that they have the opportunities for a more abundant and purposeful life. I think these two cabinet appointments will help us toward that vision, and look forward to a few questions.
Dr. Cooper, do you expect some pushback from legislative leaders because of Dr. Cohen's experience in the Obama administration at CMS?
I think that it is a positive that Dr. Cohen has experience where she has. Clearly, we do not know what the future of healthcare will be, not only in North Carolina, but in our country. We need someone who understands the ins and outs, someone who is a good manager. We have a department that may be one of the most difficult to manage in the state, and it will require significant skill to do that. You only have to talk to her a few minutes to know that she understands and gets it. She gets positive reviews from both Republican and Democratic members of Congress in the United States Senate because of her ability to bring stakeholders together to explain what's going on. And I've had conversations with leadership both at the state and the federal level about Dr. Cohen, and I believe that it will be a positive. You always have the politically charged atmosphere around this issue, and you're going to hear things being said, but when it comes down to getting the job done, and getting people healthier, this is the right choice for North Carolina.
Governor Cooper, have you had any contact with Senator Berger, the Senate leaders, about the confirmation process for these folks and your other appointees? And the other thing is, you know, that's an issue that previous governors haven't had to cope with. How are you doing that?
Well, first, we have been staying in pretty close and constant contact with the leadership of both Republican and Republican and Democratic members in the House and the Senate. And before I make any appointments, I call all four of the leaders in both chambers to let them know who I am appointing and providing them information about it. We have filed a lawsuit contending that the actions of the legislature is unconstitutional regarding the advice and consent and confirmation. We'll have to wait and see how that case goes, but we're going to proceed with constant communication with them, working with them. I expect both of these secretaries to visit individual legislators and particularly legislative leadership, answer their questions. As you know, the Secretary of the Department of Health and Human Services, under any governor, is frequently called to the General Assembly to talk about a myriad of issues. And I think Dr. Cohen will excel in this type of arena. She will get the job done, and I feel good about it. Yes?
I wanted Ms. Cohen to talk about the challenges facing her regarding Medicaid expansion, something that you put a lot of stake into already.
Dr. Cohen?
Sure. As I said before, I'm very much looking forward to implementing the governor's vision to expand the Medicaid program, because I know as a physician how important it is to have that critical access to affordable health care. And I know there's a lot of work ahead of us, but it's work that I know well. I have done at the federal level and look forward to doing here in North Carolina. That will involve working with leaders here, whether it be from the patient community, the hospitals, the physician community, our legislature, and all that are involved in this issue, work through these tough issues. I'm solution-oriented, I'm a pragmatic leader, and I look forward to hearing great ideas about how we can work together.
Do it. Thank you very much.